understand you're interested in breastfeeding, and are there some benefits that you're already familiar with?
Yeah, I'm very interested in breastfeeding. Some of the ones that I've heard, of course, the selfish one would be losing weight faster.
Okay.
I hear it burns like 800 calories. Is that true?
It's a good way to keep your weight in check postpartum. Usually you do keep on a little bit over the first 6 months if you continue to breastfeed for 6 months, just to maintain your levels for hormonal release. But yes, there is a benefit.
I've also heard it helps prevent certain cancers between you and the child. And best source of nutrition, but I'm sure there's tons others.
Absolutely. Well, it is the perfect nutrition for a newborn baby because it is perfectly for what their gut is able to digest at the time. The number one benefit that everyone always talks about, though, is the prevention against infections and illness. Babies are exposed to a lot of things when they're first born, especially in hospitals. But when they're close to their mother and being fed by their mother, they also receive through what's called passive immunity all of the different viruses and bacteria that you have been exposed to your entire life, you create antibodies against. And then what happens is they come through the breast milk and then your baby is protected from those things. We know there are certain things that they can do to really create a good foundation for their breastfeeding experience. So I'll just go over some of those things and hopefully that will be helpful. Again, I mentioned before that the mother should try and do some educating of herself prior to, so she knows what to expect. Anticipatory guidance is actually one of the most important things, because if you know what to expect, so then when the unexpected may occur, you're a little bit more prepared. The first 2 weeks after you have the baby is a very kind of magical time for you and your partner, and you want to make sure you create the space for it. Maybe not too many visitors, not too much going on. It's like a little bubble that's created, and once your partner, maybe goes back to work, that little bubble's gone. But it's also a very important time for you to be focused primarily on the breastfeeding experience if that's your desire. The first 24 hours, babies are sleepy. They may only breastfeed about 6 times. So we're not expecting as much out of them. Sometimes just 1 urine and 1 stool. So a lot of our mothers ask, well, how do I know the baby's getting anything? And that is just absolutely the first question. I don't have any milk. How am I going to feed my baby? So the colostrum that is in there for the first 1 to 3 days is all that your baby needs. But the baby's stomach is very small, about the size of the walnut. So there's really no need for them to be getting more. They're sleepy, they're transitioning. Then, as the baby sucks, then the increasing of the milk supply by about day 3, which is when most people's milk will come in, day 3 to 5. Then the baby's stomach is expanded, the baby is more alert and more awake, and then by about the 3rd day, what you'll see, excuse me, is 8 breastfeeds a day, so maybe as many as 12.
How do we know if they're getting enough?
Absolutely. It's a great question. And that's why we love to just make sure that people are using this. Because like I said, at the very bottom, we're going to be monitoring how many times a day is your baby breastfeeding. And the normal amounts are right here. First couple of days, maybe only 6 times. But by day 3, it should be 8 times a day, but could be as many as 12.
Is the time limit there? Is it like they should be latched for 15 minutes?
Absolutely. It's a great question. You will hear people from old school say 15 minutes on each side. We don't really establish that. We want the baby to completely finish on one side, and then you may burp the baby and then go to the other side. So you do want to offer both breasts at each feeding once your milk comes in after day 3. Then the next thing you're going to be looking for to make sure that the baby is actually hydrated is the number of stools per day and the number of urines.
And what's average for that?
Well, after the milk comes in, 5 or 6 wet diapers a day. So you want to be writing each one down so you can be sure that your baby's getting enough fluid and is, voiding. Then also stools are a little bit more variable. Some babies only stool once a day, and so that's your minimum. But some actually do a little bit after each one. Everybody's
That's
different.
That's probably my baby.
Exactly. So everybody's different. So just also your pediatrician, when you have your first visit, will want to know this information. Because the baby will lose a little bit of birth weight and get back to the normal birth weight at 14 days. So we want to make sure that all of these parameters are within normal range, and that is going to be how you can tell that your baby's getting enough.
Perfect. I guess I'm curious kind of how the pump works. I haven't received much education on it at all.
Well, I'm just going to demonstrate with the one we have here. This is a double electric pump. This is actually hospital grade. We use this for mothers who actually are separated from their babies for long periods of time. it's actually made to pump 10 times a day.
Wow.
Whereas some of the double electrics that people purchase are made to pump about 3 times a day when you're at work. So I will just show you how this one works. This, you can get an idea. A lot of the newer pumps that are on the market, they also have 2 phases. And this pump does, and I'll just show you by showing you this little, I'm not sure if you can see that. When you turn it on, it's pumping very quickly, very gently, just like babies suck. Because when your baby goes on the breast, the baby's going to suck really quickly at first to get the milk to let down. And then what's going to happen is you'll notice they'll slow down and they'll start swallowing and you really hear it.
Okay.
So as the milk lets down and comes, they'll get larger volumes and you hear it. So this particular pump, for 2 minutes, it'll do that. That way you don't have a strong pumping suction on at the time that the baby first gets on or when the pump first gets on. And mimic more the way the baby sucks. And then as you can see, I just went ahead and put it on to the second cycle. So it actually has a very deep suction. And you'll feel it. Not uncomfortable whatsoever. There's a knob on all pumps that allows you to go up with increased suction and then down. And every single mother is different. So I never tell a mother, I say start at the lowest and then work your way up, but only to comfort.
Okay.
We don't want any sore nipples.
Right, right.
That's not fun. So the main thing I'd like to mention about latches, and then we'll go over positioning, which is another very important piece, is that a lot of times babies will latch only onto the nipple. The one thing will happen with that is the baby won't be actually stimulating the ducts behind the nipple, which cause the milk to come down, and you'll get sore nipples, which is probably one of the #1 challenges with an initial breastfeeding experience, and possibly the #1 reason why people might quit.
Right.
So this is very important, and if you have any question in your mind when you're doing this, that it's uncomfortable to the point where you don't feel good, call someone.
Okay.
Because we can easily correct it. A lot of mothers are very familiar with this position, which is the cradle position.
Right.
Because everybody sees it in all the pictures and all.
Right.
But I'll be pretty honest with you, it's not the best position. Because there's not a lot of way that you can use your arm this way to get the baby close. We want the baby, your hand behind the baby. So you can do it one of 2 ways. Not that the names of these things matter at all. One is called the cross cradle, where the baby is across your belly, there's a pillow underneath. But the most important piece about this is the hand behind the head.
Okay.
Because we want to make sure that you're controlling the baby's head, staying close to the nipple. And then you have one free hand here that can actually help to support the breast.
Okay.
I'm going to turn the baby into the other position because I think it's a little easier to see what I'm doing. And I'm going to move this way. The most important thing also is that mother is comfortable. We don't want you leaning down towards the baby. We want you sitting up in the chair, preferably, or the bed, because your first breastfeeding sessions. The baby, there will be a pillow here, and then once you're latched, we're going to roll like a towel underneath, because we don't want your shoulders full of tension. We want you to be relaxed, because the baby could be on there for 20 minutes.
Wow.
So we need you to be able to stay comfortable. Then we're going to get the hand under the head, the same way I described, and we're going to take the other hand and use what's called a C hold, where the fingers are completely underneath the breast and the thumb is on top. Then you have a good use, and you can start to move the nipple over the baby's mouth, just like this. And then that encourages the baby to open the mouth. As soon as the baby's mouth is open, it's almost like shooting an arrow. You go, psh. It's very quick. And you want to get the baby on the nipple with the mouth open. And if you're having any trouble with that and there's not anyone in the room, please ask.
Okay.
Because in the beginning, it's just new. It's like anything new. You're learning. And also, the baby's learning.
So I guess the most important things taking from our conversation is, for me at least, is that it is positive to hear that anybody can breastfeed with a few exceptions. And to call to ask help, don't be scared to do that. And also the scheduling and the instant gratification of our culture, and getting on that baby's schedule and allowing him to tell me when to eat or when he should eat.
Exactly. And most of, especially first-time mothers, we are used to, controlling our own environment.
Right.
And so when a baby comes into the mix, it can be very challenging to allow the baby to have some of that control with breastfeeding. And not only because we don't want to give up the control, but just because it is exhausting. But it is such a rewarding experience that only you as the mother can give. And the benefits far outweigh the challenges of not having enough sleep in the first couple of months.